Can you please explain the ascites pathology in terms of Ayurveda that you think when you see the patient? Just
You see, very clear. It's very clearly Ayurveda also very clearly suggested. This is what called as a Kumbha Kamala. Very clearly said Kalantarat Khari Bhutva Kritrasyat Kumbha Kamala. It is said in Ayurveda because we don't have a specified chapter dedicated to Kamala even by our acharyas. It is under the chapter of Pandu. They explained it. Pandurogi, if he consumes a lot of pitta, kara, hara, vihara, then he lands up in Kamala. That's what they have been explained. So they are trying to tell about or they explain about the hemolytical jaundice. And of course, over a period of time, then this Kamala has been given, the concept of Kamala has been treated by Ayurveda with various medicines. And Acharyas have given very clearly there are certain names like Panaki is there, Lodara one term has been used, and Kumbhakamala is the one. Then Halimaka is the one term they are used. So these are all some of the diseases which is very close to these Jalodhara or Yakurtalyodhara and these conditions where which can be compared with hepatorenal syndrome or hepatic encephalopathy or even ascites or portal hypertension or even alcoholic cirrhosis, and all these things are they come under the purview of these areas. So in Ayurvedic perspective, if you want to use it is Jatodakavastha, Ajatodakavastha. It is usually, many a times, usually patient comes with different LFT values or even the sclera becomes yellow in sometimes. Many a times I have seen patients, the eye is very whitish, no yellowishness, but protruded abdomen. So we cannot have a systematically what the book has told. We cannot have a bookish type of or a very classical cases many times. In practice, we do come across variations. So in those variations, accordingly, we need to do it. If there is a increased pitta, even today I have a case today morning, guys, and it is a very serious nature, and that total serum bilirubin is 54.2 deciliter by mg per deciliter. 54.2 mg per deciliter is the thing. So such a type of condition where a severe increase in bilirubin is there, then we need to go for doing some sort of virechana and all those things. That virechana will help even the reducing the bilirubin as well as reducing the peritoneal cavity fluid and all these things. So we need to understand that what drug should be selected, what condition. So normal bilirubin is 1.2 mg per deciliter, but in today's case it is 54.2 and his eyes are literally yellow.